So first of all, what is COPD? And really, it is a lung disease characterized, it's one of the obstructive lung diseases. It includes asthma, things like cystic fibrosis, and lots of bronchiectasis, a bunch of things. But this is a case where the airflow, unlike asthma, is not fully reversible, not that asthma always is either, and is usually progressive and relentless, associated with abnormal inflammatory cellular responses to noxious inhaled chemicals and particles and other things that go in your nose and lung. You should think about COPD if you have a patient who has any of these very simple symptoms: short of breath, dyspnea, chronic cough with or without production of sputum, and if you do sputum production, even more so. History of prolonged exposure to risk factors for the disease. In terms of risks, I'll come back to that in 1 second. Again, diagnostic criteria: shortness of breath is dyspnea. It's progressive, gets worse with exercise, but gets to the point where it just happens at rest. Chronic cough, productive sputum, may or may not have productive sputum, and like cystic fibrosis, it's hard to get it up. And the history of exposure to risk factors, and I'm just going to show them here. It's tobacco smoke, occupational dust, and this slide talks about it. And the slide was made thinking this is older age. I don't think at my age 40 is all that old, but as you get older, it's an older disease. Tobacco smoke is probably the single most important risk factor in terms of COPD by far. You're inhaling these particles that your macrophages and your scavenger cells in your lung and your nose can't get rid of. They sort of absorb it, they can't digest it, and that creates all sorts of inflammatory changes. And there's also 4,000 or 5,000 molecules that are made from tobacco smoke, some of which are oncogenic, cancer producing. But anyway, this is probably the principal problem, is the cigarette smoking. Exposure to dust, so people in coal mines, people in wood staining businesses where the odors are releasing, you get occupational hypersensitivity and other things. People with genetic variants where they're missing things like alpha-1 antitrypsin. So they're missing some of their enzymes that predispose to the changes. And lastly, chronic asthma. I always say the asthmatics, when they're young, the allergists see them. When they get old, the pulmonary people see them. And I think the reason that is the case is as you go on, you have more and more, not just acute inflammation, but you get scarring changes and irreversible remodeling. And it becomes the chronic disease. That's the last major risk factor.